Today I was in the gym and I had a fella come up to me. I've seen him in the gym for a couple weeks now, and he introduced himself and started asking a few questions. First question being how old I was. I told him I just celebrated my 50th birthday recently. Second question was, how long have I been working out? I told him that I've worked out on and off in my life for about the last 25-30 years, but that I'd been injured and I had to stop working out for a while, and I just started back about 2 years ago. And third question inevitably is, hey, are you taking steroids? Because you're 50 years old, and I mean, you say you've been working out for about 2 years and you actually look like you have a fair bit of muscle. What I explained to him, and the purpose of this video, because there's a lot of misconception out there, is about 2 years ago, I went to see a urologist. I had to have a surgery done, and part of the standard blood panel that the urologist pulled before surgery included your testosterone level. And not at the surgery, but at the 2-week follow-up, the doctor stated to me that my testosterone level was extraordinarily low. And when I say extraordinarily low, 400 to 1200 is considered about average, depending on what site you source. My initial testosterone reading on that particular lab was 80, so I was significantly low. And then we do some testosterone replacement therapy, TRT. And so I said, we'll give it a shot. My impression of testosterone, steroids, was that you get a shot and you go home and you tear up your house, and you're angry at everybody and everything else. And I even left out of that appointment and I called my wife because he had given me a shot, and I said, hey, if you get home and I'm a raging maniac, this is what happened. They gave me this shot. I don't know what's going to happen. And basically, this was on a Thursday. Thursday I didn't feel any different. Friday I didn't feel any different. My wife crept in the house Thursday after getting home from work and peeked around the corner at me, and I was like, I don't feel anything. Thursday I didn't feel any different. Friday I didn't feel any different. Saturday no different. Sunday morning I woke up and it was rainbows and unicorns. I mean, the world was good. Everything was perfect. I felt like I slept really good. I felt like I had energy. Very, very changing. So Monday morning creeps around, I call the doc, I'm like, hey, if this is the way that you feel, this is the way I want to feel. So I'm going to put up 2 pictures, and these pictures were actually taken exactly 1 year apart. I know a lot of people who are on testosterone replacement therapy. It's not widely spoken about, but I do know a significant, I would say somewhere in the area of 40 to 60 people who are all on TRT. Some of them I actually helped get on the TRT because I recognized some of the signs and symptoms they were having, and I was able to say, hey, why don't you go get this tested and see if this is an issue for you. The one thing I'll say is these 2 photos are a year apart, to the date, 1 year apart, and a huge difference in your life. So if testosterone replacement therapy is something that as a male can help you, and I'm telling you, some of the guys who I've directed to go get tested were as young as their late 20s with low testosterone and ended up getting on TRT, and it changed their life too.